The majority of our patients will come in with spine pain, neck or low back, and often it's just, you know, my back hurts, my neck hurts. Oftentimes it's not necessary for people to have imaging done. We do a functional assessment to see what could be causing it, but often it's just prolonged positions, sometimes being too sedentary. It's not always a traumatic reason. Here's our model of the spine, and I'll take it off. And
with patients you demonstrate
right.
with the model.
So we'll try to show, because education will help, because sometimes people don't realize things that can be aggravating and things that can be relieving. So this is looking at it from the side. This would be the back, and in the front we have a little bit thicker part of the vertebrae called the body. And in between, if I spin it, in between each of these segments would be the disc. And the disc is a support structure. It's like a fluid-filled sac, and it's meant to keep the space between the bones to allow adequate spacing for the nerve roots. The nerve root is the first part after the spinal cord, which is in the center. The nerve root comes out at each level, and they will eventually supply the nerves. In the low back, those nerves go to the legs. In the neck, they go to the arms. So when people have, in the low back, sciatica pain, the traveling pain, radicular pain, it can be caused by a pressure all the way at the nerve root, and that can be coming from the disc. So what we try to do is figure out if that's what's going on, and we look at if there's any loss in your range of motion, which commonly there is, which directions have a favorable response for your pain control and any symptoms that you have in your lower body, and we try to reverse it with exercises that you can do independently. So oftentimes it's doing more extension to try to bring that pressure back so that it's not pushing on the nerve.
Right. Or should we do some exercises?
We can do some exercises. I'm going to demonstrate a press-up, which we've determined already is the beneficial exercise for you, okay? And I'm going to lay down, and you're going to use your arms and keep the rest of your body relaxed and try to press all the way up as straight, as extended as you can rather, and then just come back down. You're just pressing up and keeping your back relaxed, because what we're trying to get is that nice swoop in the low back. Get that arch that we tend to lose when we sit and bend a lot. So we're just going in another direction to try to reduce pressure and even things out. The first step is to deal with the pain. So now we're fast forwarding through the treatment to the phase where we did more strengthening. We can use the ball for things to create some instability to make the core work a little harder. So one that you really liked was doing a bridge with your feet on the ball. So you're working your legs, but you're also using your core to control the instability from the ball. So just raising and lowering like this. Okay. All right. So you're going to tighten those muscles in your abdomen like you would if your pants were too tight. And then just lift and lower. Good. Another great neutral spine exercise for your core is a plank. And you're just having the tips of your toes on the surface and holding a straight plank-like position. Again, bracing your abdominal muscles, not letting your hips dip too low, and not letting them come up too high. And just holding for an amount of time, maybe starting at 10 seconds and working your way up and taking breaks. The only thing touching are the tips of my toes and my forearms. If this is too difficult to start, it can be done from your knees. But you're still trying to maintain a neutral spine, not letting your back arch and not letting your back round. Bad day to wear a big sweater, I guess. You can't see that. And you're trying not to hold your breath, but just brace those abdominal muscles. And we'll hold for maybe 10 seconds to start. Good. So another useful tool for patients suffering from back pain, low back actually, or even neck pain, is using what's called a lumbar roll. And what this does is it supports the arch in our low back to help keep our spine nice and neutrally aligned. Use it where your low back would arch to help you sit up nice and straight. You can see if I was slouching, everything slouches. I get this forward head position, my shoulders round. It can put a lot of stress on all the tissue in the back of my spine. So by just using this support, everything is in a better alignment. And like I said, patients with neck pain as well as low back pain can really benefit from using a lumbar roll. So like I said, a lot of our patients do come in with non-specific neck and back pain, and it doesn't mean that you're not going to recover and be able to return to your prior level of function, including hobbies, fitness, pain-free life. But it is beneficial to see your doctor and come to physical therapy. You need a prescription, but you don't necessarily need imaging, and get a full, specific to your case evaluation. And back pain doesn't need to be a reason to stop living your life.